It's time again for GMP Detox Session. I was a little bit quiet in the last 2 months, reading information, sorting out different inputs, and compared to the previous clip on GMP Detox, at this time point, Annex 11 and Annex 22, together with Chapter 4 documentation, was not published yet. That was before the 7th of July. And now it's the 9th of September. In 4 weeks, the commenting phase will close on Annex 11, Annex 22, and Chapter 4. So maybe it's a good time point to have a look a little bit on the backgrounds and what happened. And so we will do that today, hopefully not with too much emotions. I just want to present the facts. So let us start at this point. The EMA started the stakeholder consultation of EudraLex Volume 4 GMP, Chapter 4, Annex 11, and what they write on their own website, new Annex 22. These documents have been published on the 7th of July. So approximately 3 months later as initially defined. That's normal, that could happen. And the commenting phase will be open until the 7th of October 2025. And I encourage you to send your comments. I think it's really needed that we send our comments to Annex 11, Annex 22, and Chapter 4. And here you see the website, the stakeholder consultation. The website is properly made. You will find there the draft versions, and for commenting, they provide Excel files. I'm still working with Excel, funny, but that's pretty simple. And EMA is asking you to send the comments on the basis of the Excel files, not PDFs, please. So it's easier for the inspector working group to sort the comments. And there you see new Annex 22. So surprise, surprise, there's coming up a new Annex, and Annex 11 revised, and Chapter 4 documentation. Before we do that, I have a small disclaimer for today. This presentation will combine objective data and facts with subjective interpretation to provide a comprehensive understanding. Anyhow, I will limit my interpretation to a minimum. So, and we will go back to Goethe, a very famous German. There's nothing more frightful than ignorance in action. That would be my title for that presentation. Let's start with the beginning. So, EMA, who and how is that done? If new annexes or chapters are written in the area of GMP, GDP, so EMA documents are written by the so-called IVG, Inspector Working Group. You find there a source, they have a kind of governance framework. You see also here the screenshot of the page itself. So they define a 3 years working plan. They provide annual reports. That's a little bit similar to the PICS. You find there something very similar. And this inspector working group is defined as a group of senior GMP inspectors with all the 27 EU member states. And even other people might join, for example, from members of the PICS, US FDA, Canada, Australia, but also Switzerland, inspectorates of the European Economic Area, which is bigger than only the European Union, and representatives from the European Commission, who will also approve that, and other so-called observers. So, but the group writing annexes is a group of senior GMP inspectors. So that's quite a very good setup. The inspector working group does have governance rules. I was also saying that. I also have here the references, the 3-year work plan. And that's very important for the industries, or as me as a consultant, to see what is on the plan for the next 2 or 3 years. The 3-year working plan for the period of 2025 to 2027 was published around March 2025. What was very interesting in there, that the new Annex 22 was not mentioned in there. So out of this 3-year working plan, which is committed with all the different members and the different countries, and even, I would say, third-party countries like, for example, Switzerland, which is also applying the European GMP regulations, are agreeing on the 3-year working plan. And out of this 3-year working plan, a mandate is created that a rapporteur is assigned for the inspector working group. The inspector working group is formed maybe with 8, with 12 inspectors to say, okay, we want to have an update of Annex 11, for example. But here, interestingly, the 3-year working plan does not mention any kind of Annex 22, which I found very interesting. Annual reports are also written. This was, for example, published, the last one, in the 5th of February 2025. The dates will be also very interesting for you later. And again, in this annual report, the new Annex 22 was also not mentioned. However, it can be assumed at this time point that anyone was already working on Annex 22. Maybe this could be an indicator for communication problems within the EMA. So the guidance for rapporteurs, there's also a governance document. I have referred it here, this long numbers ending with 79525/2025. And they define how they work, how they want to communicate, what kind of documents they want to create, and especially if they have something that happens in collaboration with the, for example, with PICS members, if they have additional observers, Council of Europe, EDQM, and other MRA partners, and the WHO, for example. The result here was a concept paper that was published in September 2022. It contained about 33 or 32 topics, what should be updated in Annex 11. Beside of that, also mentioning AI and ML. At this time point, with the concept paper, the proposed release for the consultation of draft guideline for a 3-month consultation will start in December 2025. Now, in reality, it started in July 2025. Okay, but you just must realize there's a 3-year working plan, and there are also annual reports as a result of that work. So the inspector working group does have a mandate, and they have rules for communication. So the mandate, objectives, and rules are defined in this procedure for the inspector working group. And I think in a well-organized democratic structure, people should follow the rules. So, for example, in chapter 26, communication with the public and external bodies, so with us, the GMP Inspector Working Group will regularly communicate details of its work to external organizations, blah, blah, blah. In particular, the EMA and HMA website. And I think that's also very important that inspectors, in their function being an inspector representing the EMA, if they give any information in any kind of an event, or maybe also in a podcast or whatever, that they only refer to information that is provided by the website. This didn't happen. I did hear some copies in that, and I found it super interesting that there was kind of a PDF report of an event. It's called the LFF regulation event. I don't know it exactly. On the 5th of February 2025 in Finland. You remember the slide before? the Annex 22 was not mentioned in the working plan, in the 3 years working plan, and even not in the annual report. And that happened with or after the 5th of February. So here, from this report, a drafting group under the EMA has been working to prepare a draft revision. The drafting group is chaired by blah, blah, blah. And what they say is the new annex on AI, Annex 22, will be created. And I ask myself, if I communicate that, which is not given as an information on the EMA, not defined in the working plan, if everybody had the chance of the different inspectorates in Europe and all the MRA partners, if they had the chance to comment that. I don't know that, or to agree on that at least, right? IT security is considered by inspectors a critical and inherent part of GMP. I would agree on that. The question is if that should be in the scope of an inspection. So in future, if GMP inspectors will also do IT security audits, I don't think so. And the same happened also in another event that another key session was blah, blah, blah. And there was also drafting of the new Annex 22 that was in June, but basically it doesn't matter. It was before it was posted on the EMI website. And I found it also interesting. He began his presentation by showing that all GXP areas include, and this is also interesting, that the GMP inspector is talking also about, in the context of Annex 11, about GLP, GCP, GVP. That's okay. I just give you the facts today. So, okay. So what happened, it's quite very simple, is that Google did know better than we, and even better than the EMA and the European citizens. Look at this here. That was in the Google search until July. On the 5th of February, a new Annex 11 will be created. And here I have taken the document properties of the 3 years working plan provided by the EMA in the 26th of March. So the EMA didn't know itself what happened. Found it very interesting. So on the 7th of July, I already realized for 6 months that the draft versions of Annex 11 is already delayed, and I heard rumors that a new Annex 22 was coming up. But for a period of 6 months as a consultant working for the industry and the industry itself, we only had rumors. We didn't had official information that an Annex 22 will come up, and that was interesting. So what I have done is I asked the EMA about that on the 7th of July, around at 11 in the morning. There's an online form. To form my request to the EMA, they have an internal number. It was ask 280880. So, and I started my questions like that. I started with a note, with a remark. According to the European Ombudsman, we will come to that later, this is the first contact and try to resolve the matter with the institution. EMA is the European institution for that. So, my first question was, what is the reason why the draft of the new Annex 11 is delayed? Just asking for the reason. The agency should know why they are late. Question 2, why is this delay not officially made public in writing by the EMA? By an announcement. I know that other companies and training companies already planned events and trainings for the second half of the year, and we were not sure if Annex 11, when it will come up. So at least it would be a little bit polite by EMA to make an announcement on the website. Annex 11 is planned to come in October, whatever. Again, at this time point, Annex 11, Annex 22, it was still not officially issued to the public in the morning on the 7th of July. Members of the related IVG, see Google search, have spoken about the Annex 11 and in addition about an Annex 22 for AI in public events, paid e.g. in Finland. Is it allowed that such sensitive information is given exclusively in paid events, but not by the EMA itself? I'm asking that because there's this governance guideline, and I'm asking, is that allowed by the EMA? Is that already known? Because it's very interesting that Google knows better than me. I do not feel very well with that. Again, back to the facts. The EMA IVG 3 years working plan does not name a new Annex 22, only the Annex 11. It can be assumed that the decision whoever made this, that the Annex 22 will be edited, was already known at this time point. Such additional work packages must be communicated. Keeping in mind, I'm not their lawyer, but also keeping that in mind, and other inspectorates might have a chance to comment on that. You cannot overrule the things, and then maybe other institutions are not able to add any information to that or their own opinion. Question 5. Currently, the industry is hearing only rumors about this Annex 22, nothing official. This is basically irritating because current Annex 11 is applicable to AI, and AI is a computerized system. We have the EU machinery regulation and a wonderful EU AI regulation. That's my own interpretation. I think it's really very well written. Just this uncoordinated information is massively irritating, and EMA is not supporting the European pharmaceutical industry by EMA. Why is EMA not following the EU rule, one in and one out? It's called OIOO in this case. It makes also no sense, by the way. Question 6. I think it is very risky if members of the IVG talk on public, Finland, Spain, or on the LinkedIn platform. Are IVG members allowed to talk about EMA internal processes? Is it their written duty? It's basically a stupid question. It's not. So paid events or trainings, that the current delay is caused by the European Commission. That's what I read, that the delay was caused by European Commission. That's finger pointing. That's not very nice. My own interpretation. How it can be understood, irrespective if this is true or not, which is basically irrelevant, it gives an anti-European impression to the public. As European citizens, I have the right to say that. I don't understand that. I disagree with that approach. Are you able to provide to the public a new planned date for the draft version Annex 11 in conjunction with Annex 22 and Chapter 4? Can you confirm that the 90 days commenting phase will not be shortened by EMA because of this unnecessary delay and caused confusion by the EMA itself? This is something. So because I also work with lawyers and with judges, just as a kind of preparational act to say, listen, don't shorten the 19 days. We don't know what you are doing. You don't follow your rules. So in this context, follow your rules. So, and then I always said, I'm expecting your answer until 21st of July. That was not done, by the way, but it doesn't matter. So that was my question to the EMA. The EMA answered on that on 11th of August, so 1 month later. Dear Marcus, please be aware that Annex 11 and 22, blah, blah, were published. Here's the link. Deadline for comments is 7th of October. Hope this can help you. Kind regards. You might discuss if the EMA was really answering my questions. I don't see that. If they would have written F-word, do whatever you want, we don't care. Maybe it would have been more polite, because hope this can help you. Not answering this question, I would even say that's sarcastic. For sure, I already did know that, and no question was answered, basically. And serious questions. Do you follow your own governance rules? Maybe the answer would be frustrating that they don't follow the rules. So anyhow, I see that the response is inadequate and my questions were not answered. And I reported that to the EU Ombudsman. That's also a way how to manage that. There's request, a complaint by myself. It's called EO Web 53547. We will see what happens. Timeline review. So my request on that, I submitted it on the EMA online in the morning of the 7th of July. In the afternoon of the 7th of July, at around 4 p.m., the Annex 11, Annex 22, and Chapter were published by the EMA. So I do not say that I made pressure that Annex 11 and Annex 22 was published. It could be totally a coincidence or not. I don't know. Maybe also this question is not important, but I saw that this time point, and if you watch the previous clip here on the GMP Detox, I saw it to a certain time point. I thought it's not the way how it should be, that Annex 11 and Annex 22, only unofficial information was going around, making the whole industry crazy, especially with the hot buzzword AI. We will see where this ends and where we can apply it in GMP. I think we can use it in 3 or maybe 8% of all cases, but the normal manufacturing process will not be directly affected by AI. But okay, that's another interpretation and opinion. But that was very interesting that I sent this to the EMA with that level of details of questions. Nothing was answered, but on the same day it was published by the EMA. Most probably only a coincidence. Summary. So there's no mandate for Annex 22 in the Inspector Working Group and in the 3-year working plan. Compliance with the rules and specifications at least questionable. Governance rules were not followed. From February 2025 to July 2025, there were only unofficial rumors about the EU GMP Annex 22 artificial intelligence, but not on the EMA website. Communication rules. Supporting industry, maybe. Okay, just the facts. And this is a fact, without any question. So going to the content. So that's basically we talked about the background, how it was provided and how it was done. Analysis of the content. I would say it's similar to audits. So in the first 30 minutes, 60 minutes, the first impression counts. The first impression of systematic weaknesses are continued one-to-one in the content. So we just were talking about the setup. Now we talk about content. I just give you an example. We go back to the content paper of 2022, and I was commenting it with Dr. Bernd Renger, qualified person, founder and chairman of the European Qualified Person Association. Fantastic guy, really a GMP expert, top of the top. Unfortunately, he died last year, and he was also a friend of mine. But we commented on the concept paper already, and Bernd had already also fantastic ideas, and we're seeing what will happen. And we were commenting it like that. The current concept paper contains aspects to AI and ML, which should be covered by Annex 11. However, such systems are also computerized systems per definition. There should not be the need for the IVG to invent new rules or guidelines dedicated to such systems. I was discussing that with Bernd. I thought that idea would be so stupid, but we might write about that. That there's definitely no need to that. That's a normal human, maybe a stupid reaction. If you have a new topic, we do that also sometimes. We have a new issue or something like that. So what is the normal reaction? We write an SOP to that. And this happened also here. So then we were saying currently the machine directive will be reworked. Nowadays, the machine directive became a regulation with referring to AI and ML. What we didn't know in 2022 that we will also have an AI regulation itself, a dedicated one, but that was quite very useful. We also added that in general, Annex 11 defines the regulatory requirements only, and that's important. It's defined what must be done, not how it must be done. That would be a guidance document. And I think it's very important that we provide on this level guidance documents. Even for the inspectors, that is very important. You could also have guidance documents, and we were mentioning it, that guidance should be covered by PI 011 from the PICS and PI 041. Especially PI 011, I really like that document. It's very well written, and it's a guidance document. So it's not legally binding, but this is the way how it should be, that you have guidelines and guidance documents. And PI 011 was not revised since 2008. You still can see some kind of wording taken out from GMP 4. So it should be needed to update this document. And what we did know from the concept paper, that the PICS and the EMA were doing that in collaboration. So perfectly, maybe from our point of view, to add that and to revise PI 011 together with the new Annex 11. We were summarizing, in this context, it is assumed that only minor changes to Annex 11 would be required for clarity, because the revision of Annex 11 is an already complete and well-defined document. By the way, also worldwide recognized, very well written. So that was our input. If I do the commenting now to the Annex 11 2025, I'm a little bit worried that the things that we provide, input, which is maybe, I think, on a very good level, that this is ignored, because that was already ignored. So what happened? In fact, the machine regulation came, and the following AI regulation, the AI regulation Article 64, in order to ensure consistency and avoid unnecessary administrative burden and cost, blah, 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 they have a setup with harmonization rules, and I think that's quite very good. And it also fits to our comment from 2022. No need for further guidelines. AI systems, applications are computerized systems. Basically, these are machines, according to machine regulation in the European Union. References, guidelines, details in guidance documents of the PICS. So if you would like to express kind of wishes or options or something like that, that should not be placed in law framework. So guideline is legally binding, the European GMP guideline, and guidance documents could be like guidance for industry, practical advices, and so on. I think the entire document of Annex 11 and Annex 22 was not written in an appropriate guideline language. It goes pretty much to a guidance document. Some LinkedIn users welcome that, but I also like that, but the question is, where is the right place where it should be? And it should not be on a guideline level by the EMA. Why not using the PICS documents? And our proposal was small changes to the good Annex 11, a worldwide recognized standard. So maybe now you must sit down. The current status, Annex 11 with Annex 22 together, draft 2025, it increased from 5 pages to 25 pages, 5 times more. No comment needed. So it contains, I would say, NEPI soft recommendations are included, like if you read something, where applicable, may be written by the supplier. This is not a good guideline language. I even ask myself how an inspector can give an observation based on may and where applicable. Then you will discuss where is it applicable. So what, how, increases 5 pages to 25 pages. Maybe it's not a good idea to treat people like idiots. It's not needed. The complete chapter numbering has been changed. And this is also the reason why I was a little bit quiet in the last 8 weeks reading that, because this shocked me. I have here, the first figure is the table of contents from the 2011 version. There's also a kind of substructure and different areas like the principles, general, operational phase and the project phase. Annex 11 now also contains 17 chapters, but in a totally different order with different things, and also Annex 22, now as an additional document. It would not be wrong to say it's overcomplicating everything. Just this change, if we do changes, and if you would rewrite an SOP, what if I have an SOP and there's a subchapter and I take it out, I keep it in the document, the chapter and the name of the chapter and the numbering of the chapter, and I would write, for example, then this section is not anymore applicable. It was revision 5 of the document because of blah blah blah. So this is just good practice how to write the documents. And regulations in laws, you will find exactly the same setup. So this has an effect on 30,850 at least European companies who have written SOPs, who are mapping other internal procedures, policies, work instructions to that. If you would ask me, this is a totally crazy idea. So sorry, now we have some interpretation, but that's the fact. It was totally changed. It will have an effect on SOPs. The ZLG in Germany does provide 8 memoirs, but also the PICS, and also the GAMP guide is referring, for example, today to section chapter 4.4 of the Annex 11, which was totally changed. The references within the European regulations. There's a wonderful EMA GMP question and answer website with references to Annex 11, the current version, and all this chapter numbering was totally changed. So structure was changed. Pages were increasing from 5 pages to 25 pages. Fact. Other examples. This annex applies to all types of computerized systems used in manufacturing medicinal products and active substances. API. API is defined in Part II of the GMP guidelines. And why is it just written manufacturing? Also for quality control and PQS applications, it is part of the manufacturing. But if you want to reach a lot of readers, you could not expect that everybody knows that the quality control laboratory is part of the GMP, good manufacturing practice. So it's not well written, but really shocking also for APIs. That's a design construction error, whatever, with Part 1 and Part 2. And if the annexes are also applicable for Part 2, in my experience, if you ask different inspectorates, you will find different answers. Yes, no, maybe, blah, blah, blah. But now it's written in the Annex 11. I don't know if the idea is to kill the last API manufacturers in Europe with that sentence. It's not, I do not see that positive. So in line 28, there was a need to add some data integrity topics as defined by the Alcoa Plus principles, blah, blah, blah. On the same day, sometimes you must also look in the other things that are happening. Chapter 4 was also provided. And in chapter 4, 63, basic data integrity principles, table 1 applicable to both paper and electronic systems, Alcoa++. Could that be a misadministration by an European institute providing on the same day 2 documents for commenting, and in one they talk about Alcoa Plus principles, and in the other document they talk about the Alcoa Plus principles? How can an institution do that? Do they read the documents before they provide it to the public? Do they want to create confusion or clarity what they provide? I was really, really wondering about that. About the competence by people doing things like that. Simple example, you will find others, but I was really wondering it. In addition, to note, there's a ICS PI 041 document, chapter 7.5, defining wonderfully basic data integrity principles. And nobody had the idea to refer that. If you want to have it most complex, then you write 3 guidelines with 4 different information. What I also really love is EMA, the question and answer website. There's a section for data integrity, question number 13. There's a wonderful Alcoa mapping of the different Alcoa principles, mapping to the guidelines in Part 1 and Part 2, and to the existing chapter numbering of Annex 11. A wonderful table, and that was not taken over. And that is also a good reason why you should not change the chapter numbering, because you kill the information that is given on the Q&A website by the EMA itself. Don't know if people like to hurt themselves, but makes no sense. Chapter 6.2, where relevant, again, this is not guideline language, where relevant. Requirements should include process maps and data flow diagrams, and use cases may be applied. May be applied. What is that for a language? For a guideline, not a guidance document, not a GAMP document, for a guideline, a legally binding document, where relevant. I love the requirement itself. I love to start the validation with process maps, data flow diagrams, or the process maps could have use cases, or if you think about agile world, epics, user stories, however you call it. Yeah, very good. But why? Where relevant? Tell me where it is not relevant, where you use a system in the GMP environment where you don't need a process maps or data flow diagrams. I would like to know one single example, maybe the electronic board in the canteen showing what different meals you will get today. This is not GMP relevant. You don't need to have process maps and data flow diagrams for that. But I was really thinking about it. Are there any systems in GMP process where the process and data flow are not relevant? If you find one, you can switch it out because it makes no sense. It's not part of a process and does not keep or create or having any GMP relevant data. So where relevant? So language. A regulated user should establish and approve a set of systems requirements which accurately describe the functionality the regulated user has automated. I totally disagree with that. By education, I'm an engineer, but that's very clear the responsibility of the supplier, not by the regulated user. You should not start now to write URS documents like this. So the requirements should serve as the very basis for system qualification and validation. I think that's dangerous if we now talk about and add new terms without thinking system qualification. I love the current Annex 11 because it's just saying the application should be validated. Basically, in other words, we do a kind of a process validation with, in combination, a computerized system. We don't validate or qualify a computer. We don't qualify a software. Software validation is something totally different in medical devices. And now we bring in a new term, system qualification and validation. People already had problems to make a differentiation between Annex 11 and Annex 15. And now they start to write about system qualification and validation. No, the application should be validated. Stay with the current Annex 11. Then they added a chapter PQS. We have an annex of 11, annex of a GMP guideline, and we put in a section which is already described in the first chapter, in chapter 1 of the EU GMP guideline, in part 1. Sorry, there are some typos. Line 50, all deviations occurring during validation, or so before the system went go live, we have not produced one single product. We should that's a dangerous word, all deviations occurring during validation, all deviations. So a signature was forgotten on the IQ report. We should handle that as a deviation like we would have it during production. I'm okay with that. Yes, during validation, we record all test incidents or test errors or bugs, or maybe also procedural errors that we summarize that in the validation report, that the supplier audit was done too late, blah, 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 things like this. But I would never call that deviations. What consequences that would have for the creation of your PQR and so on, that's very, very strange. That's OTT, over the top of anything. Line 6T, internal audits are planned, conducted, reported, followed up. Now language. Internal audits. Why do we use the ISO language in GMP guidelines? In GMP guideline, you will never find anything like internal audits. GMP language, chapter 1, self-inspections or quality audits. No need to prevent new terms. It will just irritate people. Okay, maybe just language. The security section. Oh, that's very interesting. Will GMP inspectors do IT security audits in future? Do they have the education to do so? That's not in the scope of EU Directive 2001/83. I don't know what the idea is behind of that. Should GMP inspectors also give calibration certificates to balances? Should they also give the license to GDP trucks? What is the function of a GMP inspector? Check IT security? The general statement in the current Annex 11 is totally appropriate. Yeah. Language, basic rules. In line 127, the chapter is called Supplier and Service Management. In all 5 subchapters below of chapter 7, the word vendor is used instead of suppliers. Okay, I'm not an English native speaker, and I could say it's similar or the same, but the supplier could be also different to a vendor. But how can you write that? Chapter supplier, and then below of that, in 5 sub-chapters, you write only vendor. Makes no sense. Okay. Basically, what was written also in Annex 11 to elimination of ambiguities and inconsistencies. But the entire document is creating tons, millions of inconsistencies. Unclear separation between supplier, service provider, and internal IT. The current Appendix 11 is pretty cool. One statement and it's done. Internal IT is an external service provider. Basta, that's it. And it also makes a lot of sense. So line 108, ownership. If a system is purchased or consists of software as a service, a requirement that may be provided by the vendor. What is SaaS? Did the inspectors join any event and they heard something about SaaS? What is the legal available definition of SaaS? There is none. Software as a service, usually like you have one installation and the different customers are working on one single application. That works quite very well for tax, salary, toll custom stuff and things like this, because there are general rules behind of that. And so different users can work on one single installation. Sometimes I find people providing LIMS systems, MES systems, say, yeah, we have a software as a service solution. And I ask them, oh, there's only one installation. How do you manage different configurations or different processes at customers? Yeah, we have a second installation, blah, blah. In the most of the cases, they want to discuss away the efforts for validation. This is my experience with SaaS. If you mention something like this in a guideline, oh my God. For a lawyer, that would be so easy. That's okay. Line 55 definition. In computerized systems, an audit trail is a secured computer-generated timestamp electronic record that allows reconstruction of the events relating to the creation, modification, and deletion of electronic records. Relating to the creation also. That's very interesting. Relating to the creation and modification. So that was a mindless copy of part 11.10e, a revision planned since 2003, because since 1993 or 1992, with the first revision of Annex 11, we had a very smart and clever setup of our audit trail. The first entry is locked anyway. That's what we write in a protocol in a script. And the first change is an audit trail. And now they changed that, what was defined in 1993 and in 2011, that even the creation should be recorded by an audit trail. There's a comment from an American consultant, so it's not only my opinion. While addressing legitimate regulatory concerns, the proposed changes raise serious questions about proportionality, implementation feasibility, and unintended consequences for existing HERE2 compliant systems. This is a major change. If you write about your comments, think about to add something that we should stay with the current definition of an audit trail. I don't know if they are aware of this major change. Continued with audit trail, line 314. Systems may, which are used to control, process, capture, hold, or report data. So basically every and each system, and where users can create, modify, or delete data, settings, or access privileges, acknowledge alarms, or execute electronic signatures. All of them should have an audit trail functionality, all of them, which automatically logs all manual user interactions, logs all manual user actions. Everything is logged. That we create a data graph, or what is our, really all of the users interactions. The audit trail basically, from its design, if I change critical process parameter, critical quality attributes, then this should be locked audit trail. But now we lock all manual user interactions. We mistrust all our users, and everything is locked and will create tons of data which can't be reviewed anymore. I think that's a checkmate for a European pharma. If this is really written like this, locks all manual use for all the systems, whatever you do. The current Annex 11 is saying consideration should be given based on a risk assessment to building into the system the creation of a record of all GMP relevant changes and deletions. Makes perfectly sense. and it's a risk-based approach. You see that the tone, the approach changed totally from define it yourself, do a risk assessment, risk-based, to one size fits all, log all manual user interactions. 95% of all systems that we use nowadays currently, which are in compliance currently, would fail with that new requirement. And it makes no sense. It makes definitely no sense. So I think the comment to the AMA is absolutely necessary. It's our duty to comment on that. Sometimes we must follow GMP, but you could also be a creator commenting the rules. And this is really needed. I'm encouraging you to comment on that. And not only people from the European Union, anyone can comment. Swiss, US, Australia, Andorra, wherever you sit, just comment it. The commentary that I'm doing in the moment is so extensive but even essential. I have a certain uncertainty that the comments will be really processed, and I even go far. I'm not sure if they will be understood. The quality of Annex 11 and 22, okay. So, option also to put in the European Ombudsman because of the maladministration, what the EMA is doing here. Is it really supporting the pharmaceutical industry? Basic questions might be allowed. Is it even allowed to create a new annex and without an EMA announcement and mandate? Does a new annex really make sense if AI alone is a computer-based system, machine-based by European law? How can we make a differentiation to Annex 11? If so, how do you separate a computer-aided system based on classical source code, if-else-then coding versus AI models? Can high-risk AI be used in the GMP environment at all? Why not follow the AI regulation? It defines human oversight is necessary. Do I have to implement Annex 11, Annex 22, and the AI regulation in parallel? I love to be European. I love the European Union, but what they propose here, it's not from this world. Can a decision by AI be proven at all? It can't. Exclusion of such systems for decisions already solved by AI regulation. No need to forbid LLMs, like it is written in the current Annex 22 draft. That will not help innovation, definitely not. Missing references and comparison between AI regulation principles of harmonization legislation in the EU. I'm not sure if this Annex 22 can stay without a mapping to the AI regulation. And the mapping would be so easy. The AI regulation sometimes read like a GMP guidance document. AI recall. Qualification requirements. The supplier of an AI should have a quality management system. Validation and test data sets are required by the AI regulation. A CE mark is required by the AI regulation. So, no need to write a separate Annex 22, integrated in Annex 11, with a wise mapping to the AI regulation, which is legally binding for all of us since August last year. What actually happens if current Annex 11 22 would become valid in the following way? Experts estimate that the implementation of Annex 11 takes 3 to 5 years. Annex 22 will be a break for innovation. The cost would not be foreseeable and would not cover at any time no added value in terms of product quality, patient safety, or data integrity. I question that very much. I could say yes, all manual entries are logged in. Yeah. And not all companies can have the full digital way. And it's not needed if you have GMP products like tea bags. totally different process. There should be some kind of flexibility. My interpretation, my opinion. Difficult to enforce from a legal point of view. Plus that there are, I would say, differences between PICS member states doing inspections and in Europe itself, where we have, in the most of the cases, very high level and very good inspections done by competent national authorities. But it is not the standard everywhere. So guidance of PI 011 would still be at the level of 2008. Now it's time to revise that. If they want to have an Annex 22, the IVG, to be able to update that in faster cycles, then the PICS would be the right one, not the EMA. Institutions are always a little bit slowly. It doesn't matter. It's the way how that is, and it is definitely fine, but okay. Then we have contrary statements between PI 041 and maybe EU and the PICS Annex 1122. EMA references the question and answer document, possibly guidelines and regulations up to ICH documents would all have to be revised and aligned to that. So tens of thousands of SOPs, training materials, audit checklist would have to be revised, like books and standards by the ISP, without added value, by the way. Yeah. I don't think that's quite very good. Okay, so that was a very long GMP detox session. I was very quiet in the last 8-9 weeks. Think about that. Please comment the current versions. Take 3-4 hours to do that. I think it's so important. It's so important. And I just want to give you some facts about the background. I really do not even like that, how it was created, how it was communicated, how it's still communicated. I believe that a good language, good guidelines in a democratic system is better. You will get more people on the boat supporting that. We have a great Annex 11. We have one. What I see in the moment, it's critical. It's really critical. So take your time, comment it. Let me know if you have questions. Let me know if you want to have this presentation or anything like that. Sometimes we must also fight and work for our GMP regulations and guidelines. Use that commenting phase. It's still not 1 month, but nearly 1 month's time to do so. We must provide that feedback. We must, I think, disagree with some things that are written in there because they make no sense. Changing the chapter numbering. For me, that's a totally crazy idea. And I would be ashamed to provide that to the European public, to 500 million people, document of such a structure. You have seen that the EMA, how they answered to me. This is not nice. This is not fine. So anyhow, please let me know. There are different groups at Concept Heidelberg, the EMA, the Qualified Person Association, also different German associations that I know that they do a commenting together.